Hello, this is Ray Leonard Jr., host of Know Better, Do Better podcast. This special episode is being brought to you by Curtis V. Cooper Primary Healthcare. Today, we're talking about the effects of COVID-19, past, present, and future, on the school systems. I have two illustrious guests here today that are going to tell you about the mental health, the struggles that happen within the school systems, and how we can overcome them.
Good afternoon. I'm Dr. Carolyn Elan, a doctoral prepared nurse practitioner employed for Curtis V. Cooper Primary Healthcare of Savannah, Georgia.
I'm Ann Levette, Superintendent of Savannah Chatham County Public Schools in beautiful Savannah, Georgia, the home to 37,000 students and 5,600 employees.
I appreciate you both being here. So, today I want to talk a little bit about, how COVID-19 has affected the past, present, and future of the school systems. You both have been working so hard within, what's been going on. The pandemic has affected so many different people, and it doesn't get the attention that it needs to get. So I want to talk a little bit about your background, where you started, and why is your passion to be in the school systems?
Oh my gosh, so that would be all day. So I'll tell you what, I am a proud product. I'm a proud product of Savannah Chatham County Public Schools, and certainly started my career here. Grew up in the system, went away, and then returned home to take care of my parents. And so I have the privilege of serving as superintendent in the school district, and it is because of my passion for serving our children that I partner with many people in the community. Curtis V. Cooper is one of my main partners because they help me attend to some really critical needs that allow children to grow and to flourish. And so we have enjoyed this partnership, but we have benefited by it specifically during the pandemic.
Dr. Elan, how has it affected you, and why is it your passion to help the youth?
Well, I'm too a product of the Chatham County Public School System, and I'm also a product as a patient of the Curtis V. Cooper Primary Healthcare. I grew up in this city, I was educated in the city, and COVID came at a time that really attacked our school system and our children. So my passion for quality healthcare and outcomes, our executive team got together after a long partnership with Dr. Levette because we were prepared with PPEs, we were prepared with physicians, nurse practitioners, PAs, social workers, psychiatrists, who can meet that need, especially at the beginning of the pandemic when things were so unknown and the data was changing daily.
Well, you lead me into a great question because I want to know, how both of your administrations handled, COVID-19 because it came as a shock to a lot of us. I know for me personally, it came to a shock, and I didn't expect a lockdown and having to explain this to my kids. But as an administration and being executives in those administrations to say, okay, here we have to figure this out to handle it. I'm sure that was a big shock, or trying to figure out how that went. So how did your administration? And first, Dr. Levette, I ask you first.
Well, I'll tell you, we were like everybody else. We were like you. Our kids went home on March 13th for spring break, and they didn't come back for the rest of that year. And the one thing that we were experiencing was just a lack of knowledge. Did not know a lot about what to expect. The government was changing daily, and the numbers were changing daily. The stories were changing daily. What we did know was that it was a medical situation. It was really about a virus that we had very little information about. So we listened to our public health officials, and I was privileged enough to have a relationship with Curtis V. Cooper Health Services so that when I didn't know, I could call them and say, what do you know? And together we could determine what our next steps would be. How we managed it was we tried to get as much information as we could, tried to make decisions based on that, with making sure that safety was first. But in order to make good decisions, we really needed to pay attention to what the health officials were saying, but also looking at our own individual context. How were we going to function as a school district, and how were we going to be able to get that medical advice on the ground for our particular neighborhood, our particular city? So we took the actions that we needed to, made the adjustments. Lockdowns were very, very difficult for us all. Made the adjustments in terms of safety, but also kept our eye on learning more so we could do something different and learning how we would keep people safe, but also try to establish a way for our students to continue learning.
Oh, wonderful. Well, and I know that the space was very difficult, especially, the schools were one facet of it, and then your healthcare providers, had to deal with a whole nother
Right.
trauma. So how did you deal with that?
Well, as healthcare providers, we knew during the lockdown, we couldn't be locked down. So we had to be there to serve the community, to serve the school board. We had to be there to provide safety first to our employees and staff. And we partnered too with our Department of Public Health. We were on calls daily. We were on the CDC call. We was on NAC calls, getting the latest data. Then we built an infrastructure team, a COVID team that we called the COVID team. And we began to put processes in places. How can we make the difference? And Mr. Grandy was very instrumental in making sure that we had adequate PPE at all times, making sure that the staff was safe, making sure that we had supplies and the revenue we needed to function every day. And the question was, how can we make a difference in our community during this time? So we started doing Saturday clinics through churches. We provided a drive-through testing site for the school system, although they were at home and locked down. When they would become exposed to COVID, they knew that all they had to do was pick up the phone, call Curtis V. Cooper, or drive through our testing site, and we were there.
Wow. Well, and I know that there's been pandemics in the past, but this one kind of hit at a whole different pace that none of us expected. So when it first came down, I want to ask you first, Dr. Elin, like, what was your initial thought, and what went into action right off the back for your healthcare center?
Well, safety of our employees. We had a lot of employees that we had to deal with their anxiety of the unknown, making sure that they had the knowledge and we had the science that they can trust, and to allow them to voice their opinion or voice their needs, but we were there to listen and we were there to hear them.
Excellent. So, Dr. Levette, on your side, you're responsible for the little ones, that the kids that are coming in, and parents are freaking out. They don't know what's going on, and I know it had to be nerve-wracking to say, okay, we have to figure out a plan. How do we keep our kids safe, but also keep them learning?
That was tough, and it's tougher now that we look back on it because it was something we had not dealt with before. So in our area, we're used to hurricanes, and we're used to tornadoes and ice storms. Every now and then we get an ice storm. We know how to manage those things because we practice for them, and they're temporary also. Like you have a hurricane, it might be 3 or 4 days inconvenienced, or maybe even a week, but there is an ending period to it, and then there's a recovery period. With this, we didn't have that as our experience. So we relied on each other. And what we did was we found a way to keep our students engaged. While they were at home, it was very challenging for parents, so we found ways to support them. Was it perfect? Not by any stretch of the imagination, but we did keep the students engaged. And that was really important because they needed some anchor. We tried to support parents, but more importantly, we tried to educate them. I did a video every Friday, and it was called Free Talk Friday. And I said to them, we don't know a lot, but we're trying to learn, and whatever we learn, that will be the basis of the decisions we move forward, and we will keep you informed. So whatever we're learning, we're sharing with you. And if we don't know the answer, we'll say we don't know the answer. But we also assure them that we had lots of professionals who were a part of our network, and we were relying on them. And we had daily conversations with everyone in that network, whether locally or nationally or statewide, so we could collect as much information as we could to help us determine the next steps. And it was really a period where we're like used to certainty. We like a pattern. We like to go to work the same way every day. We like to count on things starting at a time and ending at a certain time. That was our life, and the pandemic just upended all of that. So everyone's anxious, and our job was to stay calm, share what we knew, help people understand that unpredictability was what we were all experiencing, but we needed to stay focused on making sure the kids were safe. And like Dr. Elin, making sure our staff felt that we were supporting them, PPE, whatever we needed, we had it available for them.
Right, absolutely. Now, we're talking about the past, present, and future challenges, right? So I know hindsight is always 2020, but what was the most difficult thing to deal with when the pandemic first hit, and what was your biggest success story from the pandemic? Now that you're able to look back on it.
Wow.
I know I'm pulling it all out right now.
I think the biggest thing was, like Dr. Levette said, the uncertainty every day. Our workflows were constantly changing, how we was doing things, educating our patients. Because now they had to wear masks to get in the doors. They had to be screened. There was a process to even get in the door in order to receive health care. So lessons learned. We learned in the midst of a crisis that down deep inside, we have what it takes to make it happen and make that difference. We learned that we were stronger together as a team than I think we even realized in the past. So now we just experienced a tornado tore down one of our buildings. Well, because of COVID, we know how to set up shop in a parking lot and make it happen, and to make it happen and still be able to provide quality primary and preventive care.
Wow. Wow. That's so you had a tornado come and you said that's no big deal. We already figured that out.
It's no big deal. For 2 years we've done COVID.
Wonderful, wonderful. And what about you, Dr. Levette?
I think the same thing, uncertainty. We're just so used to doing things in a particular way. And our lives are built around that certainty. Like we count on schools to be open. We count on staff to be present. We count on buses to run. We count on places to be safe. And so the most difficult thing for us was the changing guidance. Because remember, I communicate with 42,000 people, like directly every day. It's not like if you come through my door, it is because I expect you to be there. I expect you to be a part of the circle. So it's really 42,000 plus other people, whoever else is affected, the businesses, all those people that depend on us. So we have this communication system and this whole system that's built on predictability and structures. With not having that, then it was a constant communication. Here's what we know today. We thought this was going to work, then the guidance changed. So people were responding to that. Plus, there was information coming from everywhere, and we needed to help people understand, we're going to give you this information, we've vetted it, so we're going this way. And that was very, very hard, because in an emergency like this, everybody is an expert. And everybody has an opinion, but I can't make my decisions based on 4 people in one house. I'm making my decisions, or we're making our decisions based on serving almost 50,000 people. And all these things are dependent upon us making good, sound decisions every day and helping them understand, here's what the guidance said on Monday, but on Wednesday, here's the guidance. And that it's changing, but we're going to make it through together. I think like Dr. Elin said, one of the things we learned was the power of working together and the power of encouragement and being compassionate. Because during this kind of crisis, everybody was operating on 10. And we needed to be understanding, but also help people feel safe that we were trying to do the best we could with what we had. And when you're working with children, we're all very protective. So people wanted to feel like we were making decisions in their children's best interest. I think what we learned was we're much more creative than we think. Yes. And we know how to make the whole drive-through thing work. I mean, we have people now, they don't want to do it any other way.
Right.
And like, this is the only way I want to do it. So they've gotten comfortable with those things that just came out of this whole crisis. So these new ways of doing things, some people are like, oh, I don't want to ever go back to the old way. So that's been really helpful. But we've come up with some really creative ideas that may not have emerged at this time had it not been for the pandemic.
Excellent. And I think both of you should be saluted for the work that you've put together and your staffs and everybody. One more thing before we start talking about the present state of what's going on in the past. What was the biggest misconception that you both dealt with during that time in the past? I know things have changed and you've already cleared some things up to this point, but what was the biggest misconception for both of you so we can clear some things up for a lot of people?
I think the vaccines theories for people, patients who would believe all the data that was not evidence-based data.
So you're a medical professional, so
yes.
right? So
Right.
I'm going to get my car taken care of. I'm going to listen to my buddy over here, but not the medical professional.
But not the medical profession.
Okay.
So I think that was the biggest challenge, and we were even creative in that. We did gift cards. We did $25 gift cards, and then there was the 4th of July, and we know that that was a holiday where families, they were going to be gathering. So we went from $25 to a $50 gift card. We promoted it, and we got patients who were on the fence and had not decided whether they were going to take the vaccine. They decided to take the vaccine.
Wow.
I would agree the vaccine concern, when I got my vaccine, of course, at Curtis V. Cooper, we took pictures. We wanted people to know and that, hey, we trust the vaccine. This is the available science. We trust it. So you will see that we're not just telling you to take the vaccine, that we're actually doing it and then making it possible. I mean, we did incentives also for students and also for staff. So we wanted to make sure people understood how to protect themselves. So we educated, but just some of the stories we heard were just unbelievable in terms of why people weren't being vaccinated. And you still hear some of that now. But I do think in the midst of a crisis, people are looking for leadership. They're looking for truth. And sometimes where they get it may be different than a place where I might get it. But my job is to make sure that we share correct information, or correct as well as we know it. And then we also help to try to debunk myths that often serve as a barrier to people getting good health. And then making that available to people so they don't have to work really hard to get something that's really going to be helpful to them. I think that, one of the challenges will continue to be, how do we ensure that people get the right information and not disinformation or misinformation? I think that will continue to be our challenge.
But you've always had vaccine requirements in school systems, correct?
Always. And people meet them. But in this case, that's what was so confounding, was that they have to have vaccines, and we run vaccine clinics under normal circumstances. But I think it was just the timing of all of this. And I also think there was a great distrust of public officials. So we dealt with that as well. But I think it's just the whole gravity of it was just so different than anything we've ever experienced.
Wonderful, wonderful. Well, thank you both. I want to come back to talk about the present state of what you're dealing with. We addressed the past. I want to come back and talk about the present state. This is Know Better, Do Better. I'm your host, Ray Leonard Jr. We'll be right back. Hey, welcome back to Know Better, Do Better. I'm your host, Ray Leonard Jr. We're sitting here talking about COVID-19, the past, present, and future. My wonderful guest, Dr. Ann Levette, Superintendent of Savannah, Chatham County Public School System. I got it right this time.
Yeah.
And Dr. Carolyn Elan, Chief Clinical Officer at Curtis V. Cooper Primary Healthcare. So before we left, we were talking about what happened during the pandemic when it first hit. But now I want to kind of address the lessons learned and what's being done now to move forward. So, what's happening within the school systems right now that's changed from when the pandemic first hit?
Well, first of all, we're back in person learning,
Like
and
that.
we have adapted our practices to meet, of course, the latest guidance on how to keep ourselves safe. We still focus on safety and we still focus on education, but we are learning to live with COVID. We recognize it is obviously not going away, and so we have established new normals, new norms. We know how to keep ourselves safe. We know now how to encourage people to take their test or to isolate when they need to. We have great places for them to go, get tested quickly. We've made that all work, and we continue to promote vaccines and other safety measures. So we're learning to live with it, and we continue to educate, continue to keep our folks abreast of what's happening, how the guidance is changing, but also making sure that we are planning for the future. So we're not at a standstill. Things are very different now.
Dr. Elan, for you, like a lot of people think the pandemic is over because you were able to take your mask off. But so what's happening right now? Give us the real.
It's not over. Our numbers have tremendously gone down in Chatham County, but we see them upticking just a little since we no longer have the mandatory mask mandate in Savannah. However, at the health center, we still have a mandatory mask mandate. We're living with the new normal. As Dr. Levette said, we've changed some of our protocols. A patient can come in with a cough now, and they get in the exam room. We do a rapid test on them, and we still treat them. We still do what needs to be done. A patient tests positive, we see them in urgent care, send them home. We still do drive-through testing for the school system as well as ILA. We played a instrumental part in ILA, who is one of our largest importing goods into our city. So we still provide the testing for them, vaccines for them as well.
Wonderful. Now, have you learned about the true effects? Because I know, just from my personal standpoint, my kids have had some struggles with, kind of behavioral health, mental struggles of being locked down and going through this whole pandemic. What are you both seeing in that front?
Oh, escalation of behaviors that are not typical and behaviors that are not necessarily helpful. So we are seeing more acting out behavior, and we're seeing it at all levels, all income levels, all grade levels. Just children responding to, I think, many things associated with the pandemic, or some of the things they were experiencing before the pandemic escalated during this time. But we are seeing more behaviors which indicate a need for different services. We offered always a level of behavioral intervention or mental health services in the district. That's been my commitment. And I did a lot of that through Curtis V. Cooper Health Services. But I will just tell you, I cannot at this time meet all the needs that we see surfacing. What I have noticed, and I'm happy about this, is we have more parents who are willing to admit their children need services. So that was a struggle for us before. We are seeing much more support from parents for behavioral intervention services or for mental health services. So somehow that national campaign to help people understand that it's okay to ask for help is working, because we do see our young people asking themselves, but also their parents coming in and asking for help, or us making referrals and them taking us up on it.
Dr. Elan, you have a big lift at Curtis V. Cooper, not just from supplying testing and health care for everybody, but also dealing with the mental and behavioral health side of it. So what are you seeing right now?
As a result of COVID-19, we're seeing the same thing that Dr. Levette is seeing. We're seeing patients coming in with behavioral health problem, a lot of anxiety, a lot of panic attack, increased depression. So what we've done as an organization to meet that need is we've increased our behavioral health department. We now have 2 psychiatrists on staff. We have an LCSW, and we have 4 now. We just did 3 offer letters to 4 licensed master social workers who will be clinical LCSWs in 2 years.
Wow. So
and that's just to meet the need. In order to get those patients, we're committed to being there for our children in the community.
So how can the community access those services? What do they need to do to come access those services? Because I know sometimes it gets scary to say I'm going to go to the doctor. I'm going to go find out what's going on. You know, especially in some of our communities. My community, I know for sure, it's always been a myth that like here you can't go do that because you do that then that's a sign of weakness. But how do you access that?
You can call and make an appointment. We're in the community educating our patients. And as Dr. Levette said, the pandemic has brought African Americans to the forefront to say it's okay that I need help. It's okay because I'm on the edge and I can't get a grip of it and I need help. You can call and make an appointment. We also provide transportation through Uber that will bring you to the health center as well as take you home. We also do provide telemedicine.
Okay, exactly. So when you're talking about the individual services and looking at the individual needs, you're dealing with a lot of students, a lot of people. So how is that tracking to come down to say, okay, we need to target certain areas that have not been addressed?
With us, we started way before the pandemic, recognizing that in some of our sites, we have a greater number of students who are absent, and most of the time it's linked to something, like some medical need. Like lots of kids have dental caries, and if you have a toothache, you can't do much of anything. And
terrible.
so imagine if you are 5 and have a toothache, or 7 and you have a toothache, and your parents may not have dental services. So way before the pandemic, we partnered with Curtis V. Cooper Primary Health Services and used their mobile services. They pull right up to the door, schoolhouse door. You simply walk out, get your services, and you can walk back into the school. That means mom or dad doesn't have to get off work, and we can get the services, high quality services, right at the schoolhouse door. And that's a tremendous support for our students. It also recognizes that they are having difficulty, which may in the past have created an absence from school over several days. We also have, as a result of this service, access to mental health or behavioral health services. So teachers can make a referral, parents can make a referral. What's really, I think, helpful is that parents see this as an assistance to them, and they will sign up for the services. And it just makes a difference in a child having to wait for 2 months or maybe even longer to get a prescription or to see a doctor or to see a dentist or to see a therapist. That is not what we have to do these days. And it's really because of this partnership that makes it easy. You don't have to do very much. What's important for us is children don't have to miss school, and they get the service that they need. So we've had some expansion of those services. Our intention is to expand more because the need is even greater now.
Now, you bring that up about expansion, and school has always been a safe place for kids, whether they need to go get a meal or just get away from some issues in the family. But summertime is coming, and there's a whole nother space to deal with during the summertime. So what resources are there over the summer for kids and families on both sides, from the school system and from the healthcare
Well,
center?
medically, we are still committed to provide those services in the schools because there are summer programs in the school. We're talking about a mentoring partnershiping with Dr. Levette to do mentoring and other services as well during the summer.
Oh, fantastic.
And of course, we have a very robust summer program. So it's not for you only if you didn't do as well during the school year. We have summer camps. Programs are all day long. So, at one point the idea was, well, let's just offer half day. Well, if you're a working parent, you may not be able to get off at like 12 o'clock to come pick your kids up. So we have early services in the morning and then late services in the afternoon. So you could essentially have a kid who's been actively engaged with us from about 6 or 6:30 in the morning, sometimes 7, until about 7 at night. So we offer great services during the day, both academic and also related to hobbies and things that you like, or physical sports, any of those kinds of things. Actually, the offerings are pretty cool. And then there is early morning drop-off and then late afternoon pickup. So it's really focused on supporting families, but also engaging children. They are little to no cost, and they are in our schools. So we're also able to bring other services in during the day that children may need. So it's a pretty robust program. Last year, we had a little over 8,000 kids participate.
Wow.
And this summer, we expect to have nearly that many. Now, the difference is this year, they've been in school all year. So they're not as eager this year. They're not as eager this summer. But I think, as parents start to think about, in a few weeks, like 2 weeks actually, school will be out. They'll start thinking, I might need to sign up for summer camp. But we are very proud to be able to do that. And summer camps are, wide-ranging and of high interest. And they generally fill up pretty fast.
I know there's been a whole change, and everybody's been excited to get out of what was the pandemic and get into the new space. But there's more things that are coming along. The future is not promise. It's very uncertain about what's happening. So we want to talk about, when we come back, about what are the future prevention methods and what's being done to say, here, if something else happens, because there surely will be another pandemic or another phase of COVID coming down the pike. So what do we do after that? We'll be right back. This is Ray Leonard Jr. Know Better, Do Better. We'll see you in a second. Hey, welcome back to Know Better, Do Better. I'm your host, Ray Leonard Jr. I'm sitting here talking with my esteemed, I'm making messing up, guests, Dr. Ann Levette and Dr. Carolyn Elin. So before we left, we were talking about the state of COVID-19 in the school system and the healthcare system today. Before we go on to talking about what's the next phase, I wanted to address what can you tell the audience about the COVID-19 and the vaccines today, because there's been a lot of conversation and information out there that doesn't match up with the actual science, right?
Right.
Mm-hmm. So what can we say today that was different from 2 years ago? We do have some hard evidence-based science and research that says our vaccines are safe. That our vaccines are safe despite a few side effects, a little bit of discomfort, a little bit of pain, maybe a fever, but they're safe. And it helps us to be able to go on in this new norm and provide health care and provide education in our community.
Now, when you talk about that, I know some people think, okay, here, if I have the vaccine, then I can't get COVID ever again. What explain that. Explain what does the vaccine actually do?
So it's a misconception. What the vaccine does, it doesn't guarantee you that you will not have COVID. What it does guarantees is that your chances of being on a ventilator in the hospital or dying is very, very minute. But if you have your vaccines and you take your boosters, then you're safe. We're seeing a lot of breakthrough COVID cases now where people are late getting their booster.
So how do you explain that to the parents and the students in school? That's the $10 million question. How do you explain that?
Very carefully, very, very carefully, very often, in various different ways. You know, one of the things that I think our parents have done is they've paid more attention to the science and thus the different beliefs. But what we tell them is we follow the science, the established science, and we understand the stories that they hear. But here's what we are telling you, here's what we know. We can have a really good discussion, spirited discussion about it, but we're going to rely on the science as shared by our healthcare providers and the CDC and our public health officials. That's what we're going to follow. And if they would like for our students to be educated in our system, then we want them to consider it the same way they consider all the other vaccines that students are required to take.
Excellent. Now, it seems like COVID caught us off guard a little bit, the whole world. So, for the future, going forward, what is being put in place, and how do we learn from this past pandemic that says, okay, it's going to be a little bit easier going forward, or maybe we won't be as caught off guard going forward?
One thing, making sure that we have PPEs, making sure that we continue research as well as clinical trials, ensuring that as CDC has already predicted, we may have another outbreak
Another
in the fall, that the numbers may go up again. But we are prepared. We are better prepared today than we was 2 years ago.
Okay.
I
feel better.
So
I
I feel like science and our healthcare professionals, now the pandemic is always on the forefront. So we're always looking at our inventory. Do we have the PPEs that we need? Do we have the rapid tests that we need? Do we have the PCRs that we need in order to be helpful and to make the difference in the community?
Love it. Love it. And for school, like, you're not going to keep my kids home ever again, right?
Well, we're going to try not to, but we will let you know that if they have to stay home, we will have a better sense of how long. And we also have a situation set up where if they are operating at home, they can still be engaged. And that we think that's really, really important. I think for us, we're doing the same thing, making sure we have PPEs, making sure we're staying on top of things, and making sure that we have, like right now, we have a permanent school set up for those who wish their kids to learn online all the time. And that was not a recent need because you have students who are immunocompromised. They've been way before the pandemic, and this process works for them. So we have lots more students who are signed up now. But you know, it's really good when you're able to have options. Continue to educate, continue to keep the information out front, and continue to help people learn that we have to pivot a whole lot more than we did. But we learned a lot of good lessons, and we keep that in front of people. And we also incorporate that knowledge in our planning for the future.
Wow. Both of your information has been, so enlightening today. I want to leave on a positive note. We've had a lot of great information, but what was your biggest success story through the pandemic?
For us, we never closed. We did not lay off staff. We served the community, and especially our religious community, like never before. They would come into the health center, but we literally took our mobile vans to the churches, and in 15 minutes we were set up and we was running clinics.
Wow. They say all heroes don't wear capes, right?
Yeah, right.
That's it.
And I think, for us, the biggest was being able to come back in person and do it safely. That when I think about 37,000 students and 5,600 employees, plus all the other tentacles that we had very few shutdowns. So we may have had students out here and there, staff out here and there, but we were able to keep school going this year.
Mm.
And that was quite a celebration based on people being committed to being safe, keeping students safe, but keeping education going. I'm really excited that we were able to do that. It taught us how to survive, understand, and plan for the future. So we can manage hurricanes, tornadoes,
And
hailstorms, and pandemics.
Well,
pandemic.
that's a drop the mic moment right there, and I thank you both for what your organizations have done, and for you both being on the front line and taking care of our families, our friends, our loved ones, and doing the things that not getting the credit that you're supposed to get. So I'm giving you a silent hand clap right now, and I appreciate everything that you've done. I know our audience appreciates what you've done, and we thank you so much from the bottom of our heart.
Well, thank you. Thanks for the opportunity to talk about our story.
Yes,
It's really
to talk about
important.
our story. We're in 23 schools now.
23
Yes,
schools.
yeah.
23 schools, 5 mobile vans.
Fantastic. So, just want to let you know these organizations are out here taking care of your family, your friends, and your loved ones, and make sure that you tell them that you appreciate them. This is Ray Leonard Jr. This has been another episode of Know Better, Do Better. I want to thank the Curtis V. Cooper Primary Healthcare System. I also want to thank the Savannah Chatham County Public School System for being here and talking to us, and we'll see you on the other side, and hopefully you're able to get something from this episode, and we appreciate you. Thank you. Know Better, Do Better.